be dyspnea because the body's metabolic rate is high. So the body raises an alarm to all the organs to start working at a higher pace, and that can lead to congestive heart failure. Skins, again, we have talked that there are either deposition, and also the vasomotor system is active because of adrenaline activities. So they can be wet, moist hand. Generally, they prefer cold areas. There's flushing, and all this is there. So these are various manifestations of myxedemas. Again, you can see this is thickened edematous limbs, and this will be a non-pitting edema. Remember this. Okay. And so again, they can take form of a horny calcifications, and sometimes it just diffuse, whole limb gets thickened. So various form of myxedema is also present. Overall, it's a non-pitting edema because of deposition of complex polysaccharides like glycosaminoglycans and other molecules. These are nail disorders. There's a gaping between the nail bed and there's some discoloration. So it starts separating from the nail bed, very typically called as the plummer's nail. Acropachy, again, you look at this, the nail shape, they start becoming club shaped, and the nail becomes protruding. There's a loss of this angle, which is called the Shamroth angle. And so that leads to clubbing in these patients. Alopecia also happens, especially in Graves' disease patient. So you can see thyromegaly with gaping. You can see the eyes, and the look it is, and with the thyroid swelling. Very typical case of a Graves' disease here. Now we're not going here. Okay. Then also we need to look at tremors. Now in tremors, because these are fine tremors, sometimes very difficult to appreciate them under local eyes, under naked eyes. So what we do is we keep a paper and we look at the fluffing of this paper. Or what else we can do is we can have a light source focused here, and we look at the shadow, which are generally magnified images. So which again, we can pick up those magnified images of the hand, and then we can easily put tremor. The caveat here is, remember, the fan should always be off. Many of the examiners are in habit of checking whether you'll switch off the fan or not, because if the fan is on, the paper itself will move. So again, a common sense thing, but sometimes in stress, we lose our common sense, and that's where we fall trap into this. So remember, these are some caveat. The arm should be extended. There should be paper on the fingers only, not on the, and some part of the paper should be free so that it can fluffer with the movements. Okay, this is how we check for fine tremors. If you're checking for the tongue, the whole tongue need not be brought out, because many people will start getting fasciculation as such also. So the tongue should be resting on the lower teeth and inside the mouth only, and just a part of it should be out, and then you just check for tremors if there are any. So these were the various things of thyroid disease, how we examine with the various signs, various eye signs we have talked about, and tachycardias. Now, again, at the last, we'll just enumerate signs of hyperthyroidism, which are tachycardia, palpitation, nervousness, diaphoresis, heat intolerance, skeletal muscle weakness, tremors, increased appetite, weight loss, hair loss, irritability, and goiter. Okay, remember this. And in hypothyroidism, bradycardia, drowsiness, poor mentation, they're not able to concentrate on studies, sleepy, drowsy, muscle cramps, they tend to gain weight, and with loss of appetite. Appetite is also not very strong, but still they gain weight. Skin is dry, husky voice, patient generally behave like depressed, and they have a cold intolerance. So these are all signs of hypothyroidism. So what we'll try to do is next time we'll try to take it from here ahead, and we'll we'll talk about how to manage a case of thyroid disease and in a systematic manner from where they're present to investigations and then planning their management. So this is all for this video. Bye bye.